What's going on, everyone? What's happening, everyone? Listen, welcome to the Thursday edition of Mental Health Matters with Marty. So glad that you have joined us. Sorry, y'all, I've been struggling today. I ain't gonna lie, I've been struggling today, but we are here. I am so excited that you are joining us for Mental Health Matters with Marty. Let me know you are out there, y'all. Please like and share as we do a lot of important stuff today dealing with June is Men's Health Month. June is Men's Health Month, and we want to bring on and talk about some important issues about men's health. But I am so excited, y'all, to have this absolutely amazing young man come on and join me today. Auntie, how are you? I see you're with me. Your son is downstairs cooking and everything. But listen, y'all, like and share. I'm so excited to have this guest on with me today. This absolutely amazing young man out of Atlanta, Georgia. The Mecca of the South, y'all. And he is a young man doing great work in mental health, in physiological health. Listen, I don't want to mess up his own title because I've been messing it up all night since we've been on here. He got more letters, y'all, behind his name than I can ever write. But I'm so grateful that he has decided to join me on tonight. Listen, it's exciting, and I'm excited when young men are doing the work. And too often we don't celebrate our young men. So all the way from Atlanta, Georgia, come on, put a welcome together, y'all, for none other than Mr. Jabari Dodson. What's going on, my brother?
Hey, what's up?
How are you? Y'all see, look at all these
I'm
letters he
good.
has
How are
after his
you?
name. I am a well man. First and foremost, tell us about who you are, what you do, and everything like that.
So I am a psychiatric mental health nurse practitioner candidate. I'm not currently practicing right now because I'm awaiting the board, but however, I already practice as a nurse in psychiatry.
Right.
I recently
Wow.
graduated, and I have had experience in travel in all different areas of psychiatric nursing as well as some other areas. So, and I am also a adjunct instructor as well, clinical instructor as well for nurses too. So,
Okay. Now let's you are studying for your boards as a
hmm
psychiatric nurse. Is that correct?
a
Give me
psychiatric mental health nurse practitioner,
psychiatric mental health nurse practitioner, which puts you is really one. You're a doctor.
practically.
With that, yes, you're an adjunct professor.
hmm
Yes, and
Yes.
I'm sure it goes on and on and on. We haven't even talked about all the other things you've done. What led you
hmm
to go down this particular path, especially when it comes to medicine, as a young black man in medicine today? What drove you down that path?
Well, to be honest, I knew in nursing school that I wanted to be a nurse practitioner. Initially, I didn't know that I wanted to do psych, so it's something that I just became interested in as I continued to practice in nursing because, like, my first job was in critical care, and I thought that I would like that, but I didn't. So I
Hmm.
kind of had got into psych, like, somewhat on a whim a little, because I
Okay,
wanted a break from the first job because the first job I had, I hated it. So, but when I got in psych, I enjoyed it, and
okay.
I stuck with it. I felt like I was able to build a rapport with my patients. I
Hmm.
was able to, really interact with them and see them, for a long, extended, amount of time, and I was
Right,
able to learn to, get past the stigmas that what I thought that psych was, and things like that. So it
right.
kind of led me to go further and decide that I want to be a psychiatric nurse practitioner.
Hmm.
And so I did that. I did like the job. I saw other areas such as family nurse practitioner, and I didn't care for the dynamics of that particular area and how it
Hmm.
worked. So I wanted to do psych because you had more autonomy and things like that. So that's what led me to do it.
Right. Listen, I'm having just a quick problem with the live stream here today. So my executive producer always tells me um I need to go hardwire. So this is just definitely convincing me of that and everything. But okay, Why is it so important that we as African American men, because you're going into a area where there are not a lot of African American men. When you're talking about psych, when you're talking
Hmm.
about with that, why is that field so important? And what do you want to gain from it?
I feel like definitely as African American men, it's important for us to specifically go into, and seek it.
Hmm.
Because I think it's something that we struggle with seeking mental health because we're taught to be so strong. I feel
Right.
like men in general, of all races, but especially African American, is taught to, keep on pushing and,
Hmm.
kind of more so, not really deal and process our emotions. So I
Right.
think that it's really important, for us to acknowledge that we can cry, we
Right.
can have, emotions. And I think that that's important. So, for sure.
Yes, yes. So talk to us about June is men's health month, men's health month. What does that
Hmm.
mean to you that June is men's health month, especially when we're talking about African American men and some of the
Uh-huh.
health challenges that we have?
Hmm. Well, we're predisposed to hypertension. I mean, due to various factors such as our family history and,
Hmm.
of course, our diet and stress level. Because, a lot of times in our homes, we are the providers. So, and that's important for us to focus on our health, to focus on our diet,
Hmm.
and just really remain vigilant about different things like such as prostate testing. It's important at when you're after 40, even though it can be uncomfortable for some guys because they don't necessarily want the things that come along with
Right, right.
it.
But they have now
So
less intrusive ways of doing prostate
yeah,
testing and everything now. I have my little kit that they gave me.
yeah, yeah.
Right, right. That's you can do it in the privacy of your home.
Yes,
Right,
yes,
right.
yes.
What else are you seeing that as it pertains to men's issues, men health issues?
Um, Hypertension, like I said, definitely one of them. Mental health too. I see a lot more men, use substances to try to really combat their
Right,
mental health.
right.
And a lot of times they don't like to acknowledge that they have a problem because they are fearing that it will affect their chances of getting a job, or that if they seek hospitalization, that it will follow them. So a lot of times they don't seek help. So, so pretty much that's a big thing that I'm seeing that a lot of people are, battling with, especially young men, people that are kind of more younger, like me, like in their
Hmm.
late 20s, early 20s. A lot
Hmm.
of them are having a lot of issues with that.
Right.
And to answer your question, Keith, the actual age that they recommend that you get prostate exams is 40 and plus, 40 plus.
40 plus.
So at 40.
Now, is that what if prostate cancer runs in your family? Should you see it beforehand or should you do the 40 plus? What's your recommendation
Just
for that?
still 40. But definitely you should at 40 if you're at a higher risk, because usually if a first line family member is diagnosed with any cancer, you have a 50% chance of getting it.
Hmm. Hmm. You're right. You're right with
So,
that. Keith says, thumbs up. Thank you. So
mhm.
Keith, go get your exam. I was at your 50th birthday party, so go get your exam. With that, talk to us about some more about now you're in Atlanta,
Yes, I am.
down there in the Mecca of the South there, down there, man. And
Yes.
what do you observe as being in the medical field? Definitely talk about hypertension. We talked about
Hmm.
making sure we have our prostate exams and all of that.
Hmm.
If you could um, tell Black men or just men in general, stop being afraid of going to the doctors, where that. What
Hmm.
else would you want to tell us and how to live healthier and better lives?
Definitely acknowledge and check on your sexual health as well. I think it's a topic that, a lot of times people like to shy away from. They don't like to, really discuss it. I think that even with your partners, you should ask, no matter what, you may have going on as far as like your status, with HIV or any other, STDs. I
Mm-hmm.
think it's important to discuss it, to acknowledge what, you may have going on as far as, whether you're positive or not.
Mm-hmm.
Because there are ways now that, there's Truvada, things like that. So, I think it's important to just acknowledge that, this is what, is going on in your health, and to know, it's not something that you should be afraid to know if you don't know your status. It's important to know it, because that way, if you are, you can seek the proper, health measures, and you can be on your medicine, and it's not a thing, it's not a death sentence. I think so many times, people put the stigma behind HIV, and it's negative, and they always, think that, oh, I'm gonna die, or I
Mm-hmm.
don't want to really know.
Right,
And
right.
it's really big. I mean, two maybe out of the five patients that I treat, maybe on a daily basis, may have HIV. So
Wow.
it's something that is very.
Okay, so you're so you're saying 2 out of every 5 patients that you treat in the Atlanta area could
Yeah.
potentially, ideally, have some sort of HIV status.
Yes.
So definitely talking about your sexual status, your sexual health record, your sexual health
Yes.
card in
Yes.
that. Because that's something in our communities we don't talk about. So since you talked about that, talk to us about what is HIV, what HIV and AIDS. Is it a death sentence? Because we don't talk about it in our community. We don't talk about it in our churches. We don't talk about it because it is automatically labeled as a quote unquote gay disease with
Hmm.
that. And so, is it a gay, quote unquote, gay disease? And
Hmm.
what do we do, and how should we know?
Well, HIV stands for human immunodeficiency virus. So it's a virus that is spread by bodily fluids, which is semen, feces, blood, things of that nature, breast milk. And oftentimes it can be transferred via sex, or IV drug usage,
Hmm.
things of that nature. Those are the most common ways that
Hmm.
people get it. Today, it's not a death sentence. A lot of times when people first find out, the doctors, what they do is run a series of tests to see, number one, how the virus is replicated in your body, to pick which medication would be
Hmm.
appropriate for you. And they look at your T cell count, which is basically, the amount that you have to protect, the cells in your body that you have to protect, your body against
Hmm.
uh, other foreign diseases and
Right,
things of
right.
that nature. So if you are, diagnosed with HIV, then you can be on medication, or you may not need it at first. It all depends on, what your health status is and things of that nature. And then once, you may require medications, it can change. And a lot of
Hmm.
times they can be combination meds, or they can be multiple meds. But when you are on medication, it lessens your chances of spreading it by almost 90%. A lot of people who are on their medications and things of that nature have less than almost a 5% chance of actually transmitting HIV to someone else. But
Wow. Okay. A lot
yeah,
of us don't know that. That's
yeah.
so. If I'm hearing you correctly, someone who has a diagnosis of HIV can get
Hmm.
on meds and still
Yes.
live a healthy, normal life.
Hmm.
And you're saying not transmit it?
Yes, well, they can, but the chances are slimmer.
Okay.
So, if a person is on their medications, a lot of times it slows the replication of the virus. So, the less availability of the replication, I mean, of the virus in the body, it makes it less of a chance of them transmitting it. A lot of times, if a person does not know and their viral count may be high, then they are at a higher chance of transmitting it.
Okay, excellent. Because these are definitely
Mhm.
conversations we don't have. We don't have
Yeah,
these conversations about that in
yeah.
that regard. So we have another question by Keith. Says, are these preventative drugs really good for African Americans that already have underlying historical health issues such as high blood pressure?
It all can depend on the individual, because some medicines do worsen them. It just all depends on that. I think that when you're taking the medications, you have to kind of outweigh the benefits, the risk or the benefits. And sometimes if it may affect that, they can increase other meds to kind of help with balancing it out. But in my experience of seeing patients in practice, I haven't really experienced where it affected them in that way. The common symptoms that it affects them is like it can sometimes give you a rash or kind of make you nauseous or things of that nature. Different people have different reactions. You never know until you take it.
So
And
different side effects.
that's with any medication. Yeah.
So if someone has experienced some of those side effects, what should they do?
They should go to their doctor and ask them to change their medication
Okay. Oh, is that
and see if
simple?
they can, yeah, because it's a lot of them, so they can see what other medications could be an option that may potentially work for them.
Mm-hmm. Mm-hmm. Excellent. No, thank you. Thank you. Because again, like I said,
Hmm.
that we don't talk a lot about that in this regard.
Yeah.
So let's talk about, since my platform is mental health.
Hmm.
Mental health matters with Marty. That's what we do here. We talk about mental health. We talk about mental
Uh-huh.
health among men, and you being a working in the psychiatric. So are you one able to prescribe psychotropic meds?
Once I pass boards, I
You
definitely
will.
will.
Wow.
Yes.
So talk to us about your thoughts about psychotropic meds as it pertains to we as a community. Are you one who believes that we should? Are there any preventive measures that we can do, such as changing our diet or what have you, or anything like that?
um That's a good question. I mean, being a nurse and soon to be a provider, I see the need of them.
Hmm.
I was just stressing this to a patient that was like a year older than me, and I was telling him, because a lot of people like to self-medicate with weed, and
Yeah.
weed is becoming very big, but weed is not also what it used to be. Weed has, a lot of things that are mixed in it now are causing people to hallucinate and all these things.
Yes.
So I am an advocate for it, but the first generation medications, such as the old medications like Haldol and things like that, we still use. However, there has been a lot of improvements in the medications, and with second generation such as Abilify, things like that, they work really well, and they don't have the really bad side effects that they used to. So I think that, but it depends on the individual, because a lot of times if people aren't really genuinely psychotic, and they may have
Hmm.
more of a personality disorder, things like that, a lot of times the solution is not always medication. So I'm a firm believer in the combination of both. I think that
Yes.
you shouldn't over medicate them, but I am also a believer in, if you need medication, then you need it. So
Most definitely. So Keith says first, what are psychotropic meds? And I'm learning a lot.
psychotropic meds are meds that treat, that alter like your mental status. So
Yes.
a lot of times the meds work by targeting neurotransmitters in your brain. So if you have too much of a neurotransmitter in your brain,
Come on and
then
talk
it
to us, Doc.
will balance it out. So yes, that's how they work. So it targets the brain. It's
And
all
and
for the
and
brain.
now I'm not a doc. I ain't done what you've done. Medical school wasn't for
Yeah.
me. They probably would have kicked me out because I've been trying to say, "What
I'm
are you talking
listen,
about?"
I haven't done medical school now.
Well, listen,
Yeah.
you've done more than what I've done. You about to
Yeah.
be able to prescribe some meds. I can't even prescribe a Tylenol. So, but when we're talking about that, what I always say, explain to that there's a chemical imbalance in your brain,
Yeah. Hmm.
and what we're trying to do is just help to get it regulated.
Yeah.
If I say that, because I say, I have high blood pressure. If I don't
Hmm.
take my blood pressure medicine and make sure that I'm eating right, make sure that I'm
Hmm.
exercising, making sure that I get
Hmm.
the proper amount of rest, make sure that I'm,
Hmm.
my son would get on me. He says, drinking water. We're working on that one. Pray my strength in the Lord in these last and evil
Okay.
days.
Okay.
With that, then I know that I'm off balance that day,
Hmm.
and part of my, once I get my, so I can stay regulated.
Mm-hmm.
in that. So for those who may not understand psychotropic medicines, is that the kind of the practice behind that, or for more serious things, or can someone who may be depressed get off depression medicine? Can they get off anxiety medicine and all of that?
Well, they can if they learn how to employ better coping mechanisms. However, depression can be a lifelong thing.
It
So
can be.
it's hard to say whether they can or they can't, because some individuals believe that once they feel better, and that's the whole purpose of the medication. That's just like if your blood pressure medication, helps you to maintain a blood pressure, but once you stop taking it, you could have a stroke
Mhm.
easily. So it's something that it's an individual thing.
Joseph King, I agree with. There needs to be a town hall talks on mental health issues. You're absolutely right, and that's why
Yeah.
we have this platform. And so glad that we have Jabari, future one who's be signing off on some psychotropic meds. I'm be like, hey, Jabari, I got a patient I need to refer to you. But we do need to have these conversations about it.
Yeah, it's important.
It is important because we find that the combination of therapy, the combination of seeing a Jabari, combination of seeing someone like me, really does
Hmm.
create the best possible success stories as it pertains
Hmm.
to mental health and managing it. And
Hmm.
it's okay, y'all. And I'm gonna say this for the church folk: it's okay that you see your therapist. It's
Hmm.
definitely okay that you see your nurse practitioner, and it's all right that you
Hmm.
pray at the same time. Come on,
Yes,
Jesus.
yes.
He said, everything you need is right here in the room. um,
Yes,
with that, yes, yes. So talk to us about some more about this whole thing. You went into personality disorders.
yes,
Yeah, that's a whole specialty in itself. When we're talking about
yes.
personality disorders, y'all, for those who don't know, we're talking about those who are narcissistic. We're talking
Hmm.
about this borderline personality.
Hmm.
Uh, I now help me out, Jabari. I'm of the belief system. Now, again, I haven't done what you've done, but those people, you can medicate them, but they need a lot of therapy because
Hmm.
a lot of, I believe that they do have the ability to notice when they do things wrong. But when you
Hmm.
talk about that second and that
They don't
other
have they
tier,
don't have they don't have insight,
yes,
to why it's wrong, and they try to
yes,
rationalize it, honestly.
right, right.
But there is really is no specific medication for people with uh borderline or anything like that. But I will say that they definitely need more therapy than they need medication.
Mhm.
Um
Most definitely.
and a lot of times, depending on their upbringing and things like that, it can bring about these personality disorders. That's just like I would say R. Kelly probably is a narcissist, you know, definitely. He has a lot of
Kelly's a-
narcissistic traits,
Mhm.
but that as it's often due to the lack of control, or maybe having overbearing, controlling parents.
Mhm.
It could be due to different traumas that people could have. So they
He's
grow up,
educating you, Keith, right here. He's telling you about that.
and they grow up asphyxiated on maybe challenging those things that
Yes,
they had,
yes.
occur to them and early on. So
Mhm.
it could be many things that kind of
Yes.
drive them to have it. But a lot of times the biggest thing that they have to focus on and that they have to acknowledge is just that their behavior and things of that nature are maladaptive, and
Mhm.
that happens in therapy because
Yes.
a lot of times what medication can do is kind of mask their symptoms,
Mhm.
but it doesn't really help them gain insight as to
Exactly.
why their symptoms are wrong. So
Yeah.
they don't know.
I love this because we got to have definitely a much more integrative approach to doing this thing called therapy, and
Oh
and
yeah.
and, and even with medicine, because we have too many doctors and psychiatrists who are prescribing these meds, but
Hmm.
then they never speak to the actual therapist, or we don't get informed discussing over the past 3 4 months, and are we making progress, are we not making progress, and all of that.
Hmm.
So you have these people who are
Hmm.
overdiagnosed, overdiagnosed or underdiagnosed because there's not a
Mhm.
two-way street that
Yeah.
happens in that. So now
Because
we
many times their doctors don't talk to them that much, not in, reality. And nothing against doctors, but it's true. They don't
yeah.
talk to them, that often. So yeah.
Personality disorders in my city of Los Angeles, I to see people get off of high blood pressure meds the healthy way. I hear you, Joseph. I got to have you on real soon here. You're
Mhm.
right, right. Is there a way that we can again possibly get off our high blood pressure medicines in a
Well,
healthy way?
as you get older, your veins naturally are slimmer. So it's harder to get off of them, because your veins are not as open when you're younger. So that alone puts you at a higher risk for, high blood pressure, anyways. But the most healthiest way to prevent getting on them or maybe staying off them is the
Yes.
diet and stress management.
Come on. Why is that so important? We forget our diet. We do a lot of fried chicken.
Hmm.
We'll do them. I was gonna say collard greens, but you can do collard greens with some turkey in it. Don't put all that fat back and them ham
Yeah,
hocks and all that in it.
yeah,
Come on, and
yeah,
everything is done in moderation, y'all.
yeah.
Why is it so important that we eat more green salads? We eat more
Because it's
plant
more
based.
fiber, it helps us eliminate all the waste out of our body. When we don't drink enough water and we don't eat enough
Hmm.
greens, we're not, eliminating enough. So all of these things stay in our body
Right.
longer than what they're supposed to, and then they cause, our arteries to clog, things of that nature.
Hmm.
So it's a lot that goes behind just our diet. And, I know the vegetables may not always be the most tastiest things, but they are essential for our health. So yeah.
They are. They are. Alana, who is a therapist, I love her, says, my son has ADHD, and I completely concur that a good diet is essential. You're right, because especially those with ADHD. One, we don't understand ADHD properly,
Hmm.
I believe. Now, this is just the theory according to Marty,
Hmm.
especially with children. We have to take them off of all that sugar
Hmm.
and get them more healthy foods.
And as far as medication, sorry not to interrupt you,
You're all right.
but depending on when you give them their medication and
Yes.
they eat, they can become more hyper. So it
Yes.
all depends on when you give them their meds and what you're giving them. So
Hmm.
because they're on stimulants, already as it is, and sometimes they need breaks as well from their medication because they'll
Say,
forget to eat,
say that one
and
again.
yeah,
They
they
need
need
what?
breaks.
Uh-huh.
Breaks.
Hmm.
Yeah,
And sometimes
yeah.
I know a lot of parents who during the summer months will not put their kids on their ADHD medicine.
That's because the doctors it's recommended that they get them, because a lot of times when they're in school and things of that nature, it helps a lot with them focusing.
Focus,
But
yes.
when they're not in school, you want them to kind of have a rest, because you don't because it's amphetamines is in their medication. So it can,
Right.
be addictive, and they can lose weight. And it's a lot of things that, you know, um the other factors that the medication is effective, but it has other, bad factors. So they want them to get a break during the summer when they
Yes.
are, they need to be less focused and having fun, and
That they can be a kid.
the kind, yeah, and they can eat better. They can eat more, because when they're on those medications, it's harder for them to eat, an adequate amount. If you notice, a lot of kids who have ADHD, they're skinny because
Hmm.
their medication makes them skinny. So,
Yeah. Trisha talks about how to lay off the red and yellow dyes too that are in our foods and get it, as much as we can get back into the natural foods and
oh
cooking
yeah,
and stay away from all these preservatives and sodiums and salts and all of that.
oh
It's
yeah,
going to help us. And
oh yeah,
ADHD, especially with kids, I tell you, get these kids out in the parks, let them
oh yeah.
run. You know,
Oh
get
yeah.
them on, enroll them in soccer, enroll them in basketball, get them in
Yeah.
all these things that's going to help them, one, get all this energy out, and give them tasks and chores to do. Help them learn how
Hmm.
to complete tasks as well, which is
Yeah.
so important.
Yeah.
Yes, yes. Um, Oh, sorry about that. I'll definitely it says the name of the guest here again is Jabari Dodson, and I'll put his name back up here. It says my holistic doctor said that people can get off high blood pressure medicines if they are willing to choose. If that's it, a more plant-based eating lifestyle has successfully helped many people get off of high blood pressure medicines. Yes,
Yes. Because plants rarely ever run up your blood pressure.
right.
Meat, alcohol for sure. Um, uh,
Talk about that
all of the
alcohol
things.
again. What does alcohol do? Come on. You know, we like to have a little drinky drink and everything.
Alcohol runs up your blood pressure. It does. It runs up your blood
And
pressure.
it does what and alcohol is a depressant. So if you're depressed, you don't want
Yes,
to take alcohol. Come on.
yes,
it
yes.
it
And
is.
it makes you gain weight, all type of things.
Hmm.
So yeah,
Yeah. So we have to do
but
that. So is most of our problems rooted in our traditional thinking as it relates to our culture? And why is it hard to break away from what grandma used to do?
because it's comfortable, I
Right.
mean, people like familiarity. It's
Yeah.
a thing that if it's more comfortable to do what grandma did because that's what you grew up on. A lot of people will say, "Well, I grew up like this. My whole family has hypertension. I'm gonna get it too, so I don't care. I don't need to change. I mean, they're fine. They're still living, so why should I change?"
But there's so much out there now, because especially when we talk about holistic. So Joseph, thank you for that, and Keitha. There's so much out there now, and
Hmm.
plant-based stuff is becoming a lot more popular.
It
Um,
is.
yes, yes. What do they call those plant-based burgers now? The not the ultimate burger, what have you, but there's so much stuff out there now that is really plant-based, that's really good, that can be a blessing to you and help you, that will help lower that. So you're right, taking in some garlic, looking
Hmm.
at your vitamins and herbs and everything, what you're doing in that regards as well. Jabari, you done
Hmm.
went black on us on here.
Yeah, I don't know why it did that. So somebody tried to call me,
Oh, okay.
because I can
You-
still hear you and see
yes,
you.
yes. uh hey there, Paula, how are you? You want to log off and I'll let you back in? Let's try it that way.
Okay, let me
Okay.
see. Hold
Listen, if you are just joining us, I'm not Jabari. We have this amazing future nurse practitioner on here, but that we're talking to. Listen, Jabari, he is a 27-year-old young man out in Atlanta, Georgia. I am so excited about when young Black men are doing their thing and doing what they have to do. Here he comes back. You're back.
on. Okay.
I was just bragging about you, man. What you're doing
Okay.
out there in Atlanta. Beyond Burger, that's it. The
Yeah.
Beyond Burger.
Yeah.
There's so many great options out there. Speak to us about this veggie-based, plant-based diet that people are so talking about today. And do you recommend that?
Yes, because a lot of times, what people do are they are taking like vegetables such as like, steak mushrooms. They're using it
Hmm.
as steak. Jackfruit is a big one that people use for different
Yes.
things, such as like pulled pork and stuff like that, and it's
I had a
actually tasty.
it is. I had a jackfruit taco
Yeah,
that was really
I've
good.
had jackfruit tacos. They use soy too. Soy is a big thing that they use to replace meat.
Soy is
Um,
good. I'm starting to like it a little bit better. I didn't realize there
yeah.
was so
Well,
many different
it's
textures of it.
and it's not always the best for men because it
Uh-oh. Uh-oh.
increases our estrogen, so it's not always the best for men.
Well, y'all did see. That's why we like. So, men folk, watch the soy. Watch the soy. We don't want
Yeah,
all that.
soy
Oh,
is not
you
the
just said
best
increase our
thing for men.
testosterone. You said it like,
No.
oh, okay. Since we're talking about that, let's talk about ED,
Mhm.
erectile dysfunction that a lot of men have. Hey, this is what we talk about. We talk about some real hard. What can be that? We're talking about men's health. We got to talk about
Mhm.
what affects men in there. What are some things, especially that can affect that? because we as black
High
men,
blood pressure medication.
mm, yes, yes,
Hmm.
yes.
High blood pressure medication. That's why a lot of men don't like to take it. High blood pressure medication, and depending on how bad, sometimes your blockage may be. If you have stents in your heart, you may not be able to achieve an erection because your
Yeah,
valves are so open that the blood can't rush to your penis. So, but a lot of times, because actually, what's the medication? Viagra was originally created for blood pressure, and when they saw the effects, they marketed it as a erectile dysfunction drug.
I never knew. I never knew.
Yeah.
It was for
Viagra was
blood pressure,
originally created for blood pressure.
and then oops, wrong thing. Oh, we'll make
Yeah.
it for
Yeah.
ah. Viagra
Yeah.
increases your blood pressure, sends it
Yeah,
through the
so
roof.
does.
Well, I guess so. You got to have blood going somewhere with that.
Mhm.
But listen, but it's more common in our community than we like to talk about.
Oh yeah. Well, as you get older, it happens, but it's something that's why a lot of times people don't like to take blood pressure medication, and they want to get away from it because they don't like
Right.
that side effect because it's
Hmm.
harder to get it up.
Oh, you knew that. Okay, Keith. I'm sorry you knew that. I didn't know that with
Yeah.
that. So
Yeah.
Joseph King talked about he saw someone he hadn't seen in 2 years yesterday. Said, dude looked really bad. He shared that he had suffered a really bad stroke. And he told me he loves Popeye's chicken. Dog, give up the Popeyes. You
Well, he probably looked bad, Joseph, because depending on what side of his brain that he had the stroke, he probably is non-functional. So his
Mm,
face may look a little droopy and things of that nature. But the Popeyes chicken is probably, unfortunately, what kind of contributed to his, stroke.
yes. I had a question in here about my aunt talking about, is an air fryer good for you? Because
Yes,
everyone's pumping these air fryers.
it's a healthier way to cook fried foods.
Okay.
Is it the most tasty? No, it's not the
Well,
most tasty, but
you're
it's
right. Now, I'd
good
have
for
made
you.
some wings in that air fryer. They came out slamming.
Yeah, that's about the only thing I would say that's about good tasty, because
French fries.
that's tasty too. But a lot of other things that you may try to make in there is like no. Mm-mm.
Right, right, right. Stop laughing at me, Robert. But
No,
yes, 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 yes. So in this, man, you're doing. Can I say, man, I'm so proud of you
thank
that
you.
because there is a shortage. Let me put this out there. Out there. So thank you. Robert talked about he loves his air fryer.
I mean, it depends on what you're cooking. Now, you can make some good things, but some things you're like, oh, I don't
I
think.
done fried some catfish in my air fryer.
Yeah, I've seen people do a lot of tasty. I can't eat fish. I eat shellfish, but I can't eat, actual
Oh,
fish. So, I see people who eat fish. It looks pretty good, you know.
okay, okay,
Hmm.
okay.
Yeah,
But no, let me say this again. I'm so proud of you because of what you're
thank you,
doing. You're a young man who's making waves and being an example for us. And one of the
thank
things we
you.
don't talk a lot about, there's a shortage of psychiatrists,
Oh
y'all,
yeah,
in our country. Talk
oh yeah.
about this shortage and who makes up this whole psychiatry field right now.
We do. That's what the psych nurse practitioners do. Because I think, totally across the board in like 2015, there were maybe like 33,000 psychiatrists across the world, and a lot of them are getting old.
Hmm.
So
Say
we're
say that number
coming
again. How many? What?
33,000
Where
for
at
the
again?
whole United States.
Yeah, 33,000
So
psychiatrists in the whole year. And let's talk about the makeup, cultural makeup of these psychiatrists. They're predominantly what? Black folk?
no, they're predominantly white. They're
Right.
predominantly white, and a lot of new medical students are not aspiring to go into psych
They're
because it's
not.
not something that is the highest paying specialty. Now, it is high paying, like for sure. And if you master it, I know psychiatrists that do very well. I'm
Right.
talking about like close to $1 million a year. It more than that, depending
Okay,
on,
I may have to change fields. Maybe I'm too old to go
So
back to school now.
yeah, yeah. So yeah, so they make good money, but I think it's just that if the passion is not there, because a lot of times they just don't want to deal with they don't want to deal with what comes with that. They don't want to deal
Hmm.
with the patients and the
Hmm.
population. And I
Hmm.
think sometimes people kind of snub psych because they feel like, oh,
Yeah.
it's not, as prestigious, or it's not as, acknowledged as being a surgeon, or, things like that. Even, I mean, some people that I met that have done nurse, that are nurse practitioners, and they have done other specialties, they kind of snub it, and they're like, well, why would you want to do it? And actually, the specialty of psych as nurse practitioners is the highest paid. So,
Right.
I mean, yeah. So,
Yeah, yeah. Robert, you're right. You're right. That's certain that's of the psychiatrists, and so psychiatrists have to go to medical school
hmm
in that. So now we're talking about if there's a lack of psychiatrists, and there's also a lack of black male therapists. So when we're
hmm
talking about black men being misdiagnosed,
hmm
over medicated because we're not spending any time with them, or
hmm
not medicated at all, here comes the conundrum of why we have major mental health challenges within our
hmm
communities, because we don't have anyone that we can go to
oh yeah.
in that regard. So men just don't trust. The system has done us wrong as far back as even before the Tuskegee experiments and all that.
hmm
When we're looking at the numbers, especially down there where you guys are at in Atlanta and down
Oh
south,
yeah.
the disproportionate amount of black folk that have contracted and died from COVID-19, we make up 12% of the population. However, we could have made up a third of the deaths as it
hmm
pertains to COVID-19.
hmm
Those are alarming, and it has to do with our physical and physiological and psychological health
hmm
in that. So that's why this conversation is so important. Yeah, Daryl,
hmm
we see you. This my executive producers in the
Oh.
ATL. So I see you, Daryl, in that with that, right. So this is a lot to unpack. A black, yes, it is a
Yeah.
lot to keep to unpack in
Yeah.
that matters as well. Facts of the matter, people are eating too much processed food. You're absolutely right, Joseph. I said people are not drinking enough water. That's why there's high blood pressure of people in our black community suffering from serious health issues. It is that,
hmm
and
hmm
when a pandemic like this hits our country, it hits us hardest because we're
hmm
not prepared. We're
hmm
not exercising. I was
hmm
talking to, I don't know why I got all these connections in the ATL, Dr. Donovan Christie, who is a
hmm
holistic MD. And he was
hmm
talking about when we're looking at for men, looking at our waist sizes. And I got to go in here and
hmm
do some crunches tonight.
hmm
When our waist sizes are getting
It puts
past.
you more at 40 inches. It puts you more at a risk for metabolic disorder and diabetes.
Come on, say that one more again.
It puts
Yes,
you more at risk, definitely, for diabetes. Well, first in metabolic disorder, and then diabetes, which
yes,
eventually goes to diabetes.
right, right. So we have to uh, measure our waistlines, y'all. Come on, let's get back to that. I ain't gonna get back to my 32 days, but I'll be quit laughing. But I sure desire to get back to my at least my 34
Yeah.
in that, but we have to be mindful of that because it does affect us, and
Oh
then
yeah.
as a result of that we become depressed.
Oh yeah.
We then, because of our depression, we then begin to isolate. Because we're
hmm
isolating, we might eat too much, we might not
hmm
exercise at all. Then we like the
hmm
sugar cravings, we like the salt
hmm
cravings. All of that now is then contributing to our diabetes, contributing to our high blood pressure.
hmm
Yeah. So,
Yeah.
what do you recommend to break the cycle?
I would say just in moderation. I think
Yeah.
it's unreal to say that you may not consume fried chicken, or whatever. I think it's just in moderation. I think that's what's important. I think
Yeah.
sometimes we just overdo it, and that's what kind of makes it you know that's what kind of that's what kind of makes it, just bad for us. So
Right, right, right. Robert, you're too funny in that. Yes, yes. Joseph talks about before slavery of African people, we didn't have heart disease or high blood pressure. So the European uh, eating habits has messed up Black folks. Shaking my head, yeah.
Mm-hmm.
And we have to look at what we're doing. So really, I think our charge here really is to examine in this Men's Health Month. Let's take a serious look at. I challenge
Mm-hmm.
the men out there. Let's take a serious
Mm-hmm.
look at our eating patterns. Let's take a
Mm-hmm.
serious look at our mental health patterns
Mm-hmm.
and get rid of what I always call the stinking thinking and
Yeah.
change our mindset with that. And
Mm-hmm.
definitely let's make a big difference in that because we have the power to change
Mm-hmm.
what we do
Mm-hmm.
in that as well. Yes. Well, listen, Jabari, I got to have you back another time, man. I
Thank
appreciate
you.
you coming on and everything. We've been trying to get this together. I know
I know.
you work like a Jamaican without any straw, trying to. Yeah,
Yes,
but
I
man,
do.
I'm so encouraged by you and definitely what you bring on
Thank
and
you.
lend to helping out not just young people but everyone in that. I love it. Thank you, Robert. He says accept the eating healthy challenge. That's right. Hashtag eating healthy challenge. So Robert,
Yeah.
that's what we're doing. We're going to do a hashtag eating healthy challenge here on Mental Health Matters with Marty. Robert
Yeah.
is leading the way in that says we must change our bad eating habits. Yes, our life depends on it.
Yes.
Joseph, you are so right in that. Thank you, Jabari from Robert.
Thank
Yes,
you. Thank
y'all
you,
tell
everyone.
Jabari thank you. Listen, this is a young man in the trenches. I love these young people. Alana, she's another young, amazing therapist. In that, Joseph King, I need to get you on the show here real soon, man. Shout out definitely to everyone. Thank you so much for those of you who join us here on Mental Health Matters with Marty. In that, yes. Joseph, yeah, he says, thank you, Jabari.
Thank you.
Listen, we just want to educate and get us out of our past and what we're definitely doing so that we can live healthier lives in that. Alana, you're definitely welcome.
You're
Let's
welcome. You're welcome.
see,
Thank you.
Jabari's all right, DJ, ain't he? Listen, oh, yes,
Thank you.
yes. Go far, Jabari. Yes, he
Thank
is.
you.
Yes, see,
Thank you.
they love you out here, man. Yes,
I
yes.
got to make a visit.
Yes, you do. Yes, you do. Eating healthy challenge. I'm doing it tomorrow. Oh,
Okay.
Daryl, you're gonna make me look bad. Really? I was trying to wait till Sunday or Monday, but we're gonna. Oh, excellent, man. I appreciate that. Yes, you see everyone talking about how great you are. You are because we when we see young men such as yourself, we know you're going to tell us the truth. We know that you're going to be truthful with us. You look like us. You've experienced what we've experienced. You know in that, and that's what we love, man. And so thank you again.
Thank
How
you.
can people find you?
You can find me on Facebook. My name is Jabari J. Dobson. That's my name on Facebook. My name on Instagram is Jabari_Dobson. So, yeah.
Yes, there we go. Jabari J. Dawson. Now listen, he ain't trying to get any marriage proposals, nothing like that. Y'all see that?
Oh my God.
He's trying to save his money, so don't be trying to
Yeah.
right. Message Jabari. Hey Jabari. Man, but we thank
Yeah.
you. Thank you
You're
so much.
welcome.
Listen, as always, you can find us on Mental Health Matters with Marty and marcelconsulting.com with that. Listen, and join us on our podcast with Mental Health Matters with Marty on Apple, Google, Spotify, Stitcher, and iHeartRadio. And if you want to stay in tune with what's going on, you can always text I Matter to 31996. Type I Matter to 31996. Again, we want you to speak up, speak out, and live. You don't have to suffer in silence, but we want to help stop the stigma, not only about mental health, but men's health as we deal with and go through this whole month of June. So again, Jabari, everyone's just saying thank you so much. We definitely love what you're doing, Jabari. Apple cider, ugh. Are you drinking apple cider vinegar?
Yes, I am.
Really?
It's really good though. It's good for you. It's really good. The flavor I got is it tastes like apple cider, not really more so the vinegar. It'd be
Okay,
that
now I
apple
can
cider.
handle that, but that other stuff I don't know if I can handle and everything.
Yeah,
But yes, yes. Listen again, Jabari. Thank you so much for joining
yeah,
us. We really, really appreciate you and everything. So,
yeah.
y'all, stay tuned for us as we're going to be doing some other stuff this weekend. I'm so excited this weekend to be joining Portia Scott as John Henry Scott III is going to be hosting us this coming Sunday. I'll send out the information with that. And Dr. Donovan Christie as we continue our discussion about men's health and what that looks like for the month of June. As always, we want you to speak up, speak out, and live. Thank you guys. See you next time.